officer. My name is Valerie and I'm going to be the nurse performing your HEENT and mental health exam. Okay, so the HEENT stands for head, ears, eyes, nose, and throat. Once we finish that, we'll move on to the mental exam. Okay, so first we're going to look at your skull. We're going to look that everything is symmetric. Please look straight ahead. Okay, no abnormalities. I'm looking for lumps, scratches, lesions, anything like that. We will next begin by examining your scalp. Okay, I don't see any bumps, lesions, everything looks intact. Your hair appears to be even throughout. We don't have any thinness or anything like that. We do see that the hairline is starting to recede in the frontal aspect. Other than that, everything looks okay in that aspect. We'll next look at your skin. We're going to look to make sure that there's no lesions, cuts, anything like that. We do notice a little bit of acne on the bottom part of your chin. Other than that, there's no swelling, no lumps, lesions, anything like that. We're going to start looking at your lymph nodes. What I'm going to do is I'm going to palpate your lymph nodes. If you feel any tenderness or discomfort, please let me know. We're going to start with the submental, the submandibular, the tonsillar, the parotid, the preauricular, the posterior auricular, the occipital, the superficial cervical, the deep cervical, posterior cervical, and subclavicular cervical. Any pain there? Next, we were going to move on to look at your trachea. So first, I'm going to feel the back of your throat. I'm going to look for the cartilage. That's right around there, okay? We're going to look at your thyroid gland. I don't notice any goiter, no lumps, bumps, anything like that. It feels symmetrical. Okay, next we're going to start looking at your eyes, okay? So I'm going to ask you to just stand up for me. You're going to stand behind this line, which makes you 6 feet away. Okay, you're going to please read this, cover your left eye. And then you're going to read the smallest line you're able to read.
LTFPH.
Okay, now cover the opposite eye. Read the smallest line you're able to read.
LTFPH.
Okay, now uncover both eyes and please read the smallest line you're able to read.
LTFPH.
Okay, perfect. You can go ahead and take a seat. So looking at your eyes straight ahead, I notice your pupils are 4 millimeters. Okay, your iris, your sclera is nice and clear. I'm gonna use a little bit more hand sanitizer. What we're gonna do is we're gonna pull it down on your eyes. Your conjunctiva, I don't see any redness, irritation, no bumps. We're gonna pull up a little bit. Okay, nothing abnormal there either. I'm gonna take this pen light and I'm gonna flash a little bit of light into your eye. All I'm doing is to check the reactivity, okay? Just down straight ahead. So both pupils are reacting briskly. They both are symmetrical, no abnormalities. When we look at conversion, please follow my pen light, okay? Conversion, the eyes are equal. There's no abnormalities there, and they're all symmetrical. So next, you're gonna be following my fingers, and just please have your head still, and we're gonna move around. Okay, I don't notice any nystagmus. The eyelids are properly drooping down. I don't notice the eyes sticking out more than normal. Everything appears normal there. Okay. When we did shine the light into his eyes, we did notice that wrist movement, and when they dilated to 2 millimeters, okay, which is completely normal. Now I'm going to shine this bright light into your eye, okay? You don't have to do anything. All you're going to have to do is stare straight at me, okay? We're going to be looking for your optic disc, your retinal, and your retinal veins. So just look straight ahead, please. Okay, I'm able to see the optic disc. It's white. Retinal veins are intact. I don't see any hemorrhages, no lumps, nothing like that. We're gonna look at the opposite eye, okay? Okay, we're able to visualize that optic nerve, no redness. The optic disc appears white. Your retinal vessels were intact, no rupture there either, okay? Next, we're gonna move on into your ear. So first, I'm gonna examine the outside parts of the ear. There's no lumps, lesions, everything appears normal in both ears. Next, I'm gonna start palpating your auricle and your mastoid. Any pain at any point? No? Okay. Next, we're gonna start looking at the inside part of your ear. So I'm gonna look at for cerumen, discharge, redness, or swelling. Just look straight ahead for me. Okay, we do notice some wax. The ear canal appears nice and pink. The tympanic membrane is white, clear, and intact. I don't notice any drainage or swelling. Next, we're gonna look at his other ear. So we're gonna look deep in there. We do notice some cerumen, no leakage. The ear canal is nice and pink, no drainage. The tympanic membrane is white, pearly. No abnormalities found there. So next I'm going to do a whisper test. All you have to do is just repeat the number I'm saying to you, okay?
4, 3,
We're going to go through the back.
2, 2.
Perfect. So next we're going to be performing the Weber's test. And this, you have to just let me know if you hear any ringing and if it's bilateral, okay? Or if you hear it more on one side or the other. I'm going to be placing this tuning fork on the top part of your head.
I hate the same.
On both ears?
Mm-hmm.
Perfect. That's a positive Weber's test. Next, we're going to be doing the Rhine test. So I'm just going to be putting this on the back part of your mastoid bone, and then we're going to let it hear afterwards. Let me know when the sound stops, okay?
It stopped. It stopped.
Perfect. Now we're going to look at your left ear.
It stopped. It stopped.
Okay, perfect. We have both positive tests, which means that it's completely normal. The next step is we're going to look at your nose. From the outside, it looks symmetrical. I don't notice any lesions, bumps, no blood. Next, I'm going to shine a quick light into your nose. All you have to do is just look up for me, please. Okay, we notice some clear drainage on both nostrils. There appears not to be any swelling, no obstruction, nothing like that. Everything looks okay. The next thing we're gonna do is I'm gonna be palpating your frontal and maxillary sinuses. So just let me know if you experience any pain, okay?
Mm-hmm.
Feels okay?
Yeah, we do.
Perfect. Next, we're going to be looking at your mouth, okay? So just looking at the outsides, we're able to see that your lips are nice and intact. We do notice some chapped skin, but they're nice pink. Everything looks symmetrical. Smile for me, please. Perfect. Now we're going to be opening your mouth. Go ahead and open for me. So we're able to see the inside of your mouth is nice and pink. Your gums appear to be intact, nice pink. I don't notice any receding into your teeth, your dentation. Everything looks okay. Your teeth are slightly yellow, but everything looks normal, symmetrical. I don't notice any lumps, lesions, anything like that. Next, I'm going to ask you to stick out your tongue for me, please. Okay? Your tongue is nice and symmetrical, no drainage. I don't notice any cracks or candida. So that means that your cranial nerve number 7 is intact. Now go ahead and stick out your tongue for me, please. I'm going to press that on your tongue, okay? Just let me know this might make you gag. So go ahead. Okay, perfect. So your vagus nerve is intact. Let me look at you real quick. That looks symmetric. Tonsils are nice. There's no redness, no swelling. Everything looks okay. Okay. So it looks like that was part of our HEENT. Now we're going to focus on your mental health exam. Okay. So the way this works is you let me know if over the last 2 weeks, how have you been bothered by any of the following problems? Okay. So what we're going to do is answers are not at all, several days, more than half the days, or nearly every day. Okay. Little interest or pleasure in doing things.
Not at all.
Feeling down, depressed, or hopeless.
Not at all.
Trouble falling asleep or staying asleep, sleeping too much.
Not at all.
Feeling tired or having little energy.
Not at all.
Poor appetite or overeating.
Not at all. Not at all.
Feeling bad about yourself or that you are a failure to or have left yourself or your family down.
No.
Trouble concentrating on things such as reading the newspaper or watching television.
No.
Moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual.
No.
Thoughts that you would be better off dead or hurting yourself.
No.
So if we add all of these together, your interpretation is a 0, which means you don't have a high risk of depression. Do you agree with this statement?
Yes.
Okay. Any other question that I can help you answer? Okay.
No, ma'am.
Thank you so much for your time.
Thank you.